70 years, Shaw & Associates has been your trusted experts for wealth management, tax, accounting, and payroll. We change lives and inspire true wealth, one person, one family, one business at a time. Shaw & Associates is a wealth management investment firm that specializes in taxes, serving as a fiduciary, putting your interests first. You can find more information or schedule an appointment by calling 530-674-1150 or on the web at shawassociatesinc.com. Shaw & Associates is proud to support community radio.
And I have a 9 o'clock interview, and you might say, well, Fish, why are you doing a 9 o'clock interview? Because this is significant for our community, and I'm very privileged to have a couple of doctors on who have already decided I need help. They're very kind about the way they said it, and so we're... Anyway, I have Dr. Edward Kalpas. Did I say it right?
Kalpas, yes.
Oh, I did good. He's MD, MAS, MPH. I have to ask.
It's not miles per hour.
I know. That's what I thought, Doc. What is that?
It's a master's of public health. So we learn how to keep populations of patients healthy. So I also do see patients one-on-one, but it's really a population health approach.
So like if we got a bunch of Italians here, you know how to treat them in specific.
I'm Italian myself, so yeah, you just have to give them more pasta and pizza, and then they're happy and healtty, right?
Gosh, I'm telling you, I hope a doc never tells me, no more pasta. What? You got to be, I guess I'm dying, Doc. And then you're at Peachtree Health.
I am. I'm the chief medical officer there, and so I oversee all the physicians there and, help patients stay healthy and get access to care.
All right, so where did you come from? And don't say Mr. and Mrs. Kalpas, okay?
I grew up in Massachusetts, actually, outside of Boston, and then I went to school up in New Hampshire and D.C. and been kind of all over the place. I was in the Army. I was a medical doctor in the Army, and so got to serve our active duty forces.
I was born in Brooklyn. I was waiting for you to say.
Oh, Brooklyn. I lived on Long Island.
Did you?
I went to Stony Brook, and so I actually lived in Bayside, Queens for a little bit. I've lived in Manhattan, out on East Setauket.
Those were all the people that can afford to eat pasta other than at home.
And I got to work at the North.
How did you end up in California, Doc? I
was actually recently in Arizona, and then this really great opportunity to serve here in California came up at Peachtree, and I hopped at the chance. It's a really great group of physicians and team, and we really serve a lot of Medicaid patients here and the underserved, and that's really something that's important to me, is helping people that really need the help the most.
That would be all of us. You just described the entire community, right? And then, my mic is really low. Okay, hope that works. Sorry. My engineer is letting me know. Maybe it's me. I don't know. Anyway, and then I have Dr. Doug Matthews, MD, FACS. And I want to know what the fact is. What's the fact? What does that mean, Doc?
Good morning, Fish. So FACS is a title that comes with being part of the American College of Surgeons, and if you're rising to sort of the leadership side of the American College of Surgeons, they make you a fellow of the society. So FACS, Fellow of the American College of Surgeons.
So they make you a fellow and they make you nervous.
That's
right?
it.
It's like, uh-oh.
That's it.
comes,
Everybody's watching you now.
Yeah, exactly. And then so you are do I say this right? Colorectal?
Correct.
Colorectal surgeon. Your partnership with the Health Plan of California, but you are a regional medical director, which means how many counties?
Sure. So I'm a colorectal surgeon up in the Chico area as part of an office called Valor Oncology. We also have a Reading sub-office. But my day job 4 days a week is a regional medical director for Partnership Health Plan of California. And Partnership has the honor and the contract with the state DHCS to provide the Medi-Cal plans services in the region. So we have a Chico office, and we're serving Yuba, Sutter, Butte County, Colusa, and Glenn counties. So those are the 5.
You probably have to change the tires on your car more often than most of them. Hope you don't have an electric car.
Do spend a lot of time on the road.
Yeah. That's one thing I understand. There is the downside to electric vehicles, and that's the weight causes them to wear out tires faster.
Very true.
But pretty soon we'll be getting, one of these companies will come up with electric car tires, right? All right. So where did you grow up?
So I was actually born in Boston, trained for my medicine in Boston, so I overlap a little bit with Dr. Kalpas. But my father, who was a colorectal surgeon in the mid-1980s, brought all of us to Chico. So I grew up in a colon surgery family, grew up in Northern California, went to train across the country, Boston first, Salt Lake City, Utah for surgery training. Robert Wood Johnson in New Jersey for colorectal fellowship, and then I've been back in Chico since 2010.
I'm sorry you had to go to New Jersey for a while. Some things in life you can't keep from. I am not partial much. So that's amazing, because you don't often hear that. You say, well, I became a doctor, my dad was a doctor, or I played baseball because my dad did. But you actually stayed in the same field.
Yes.
That's huge.
I had the honor of working directly with him in the office and doing surgeries together for 7 years up in Chico.
Oh, wow.
Oh, man.
It was terrific.
Come on, that's cool.
Yeah.
Yeah, we don't all get to do that. Yeah. Yeah, I couldn't get in my father's profession. There were laws against it. So it's an Italian thing. Just kidding. So I want to know a little bit about this, because this is Colon Cancer Awareness Month. And, being VA Health, there are constantly different areas that become more prominent than others. Why is this so critical at this particular juncture? Is there more colon cancer than there's been before? What is bringing a heightened understanding of we need to tell people about this?
Yeah, actually, the rates of cancer, and particularly in younger patients, is actually increasing. And so it's very important to get screened for colon cancer. And it is a cancer that is preventable mostly through screening. And I got screened myself when I turned 45. For normal risk patients, we usually start screening at 45. And they actually found some polyps when I got my colonoscopy, and they were able to remove those, and that helped prevent cancer. It could have grown into cancer eventually, and I just got my recheck recently, and I was totally polyp-free. So that was a great example of how screening might have saved me from getting cancer, actually.
Doc, what is a polyp? I mean, I hear that all the time, right? What is that?
It's a little growth that starts inside of the colon, and it can eventually turn into cancer.
Oh. Is it common? Polyps are common, but not always cancerous?
In about a third of the colons that we take a look at with the procedure called colonoscopy, a long flexible scope that we go and look at the inside of the colon, we should find adenomatous polyps a third of the time. So 30% of people will have polyps.
Oh, that's amazing.
And we don't know which 30% those are, which is the challenging part. And so that's the reason we bring this to everybody's attention every year in March, is the colon is unfortunately a forgotten part of our anatomy, unless it's not working well for you.
And then it's like all of a sudden, wow, we need to do something about this.
That's exactly right. So,
so the colon is like the big one that goes around all the other intestines?
Correct.
So how do you... So a colonoscopy is actually a camera, right?
Correct. So it was developed the end of the 70s, early part of the 1980s, when we had good video technology that we can put small cameras at the end of scopes. And the other piece was having light. So we were waiting for fiber optics to get to the point where we can have a strong light source at the end of this long flexible tube. But yes, from the 1980s on, colonoscopy has been the gold standard for both diagnosis of colorectal diseases, but also for prevention of colorectal cancer by removing these polyps. And unfortunately, I also share some history with Dr. Kalpas in that regard. Heard that my father had some polyps, went and got my colon checked a little early. I also make adenomatous polyps in my colon. Every 3 years I get a colonoscopy. It's bad advertising to be the colon cancer doctor with colon cancer.
It doesn't look well. I don't know what you would use. You have these acronyms after your name. What is the one with oops? I mean, what do you call that
That's
one?
exactly right.
Yeah. And so is it a pretty common practice for a doctor, like if you have a GP, right, your primary care, is it a pretty common practice for them to look at your age and say, I need you to go do this because then we know down the road you're going to be fine? I mean, I guess what I'm asking is, general practitioners aware of this enough that they will automatically recommend it? I know the military does.
Yeah, once you hit 45 average risk patients, it is recommended that they get screened either through colonoscopy that we talked about, but there's also at-home tests that can be done as well for people that aren't high risk. They can do test kits at home as well.
That's what they did with me.
Certain patients, if they're higher risk due to having family members, close family members that have had colon cancer, sometimes we'll do the screening earlier, but generally once you hit 45, we'll recommend starting the screenings.
I think what you said, Doc, about it being preventable. Can we talk about that just a little bit?
Sure.
Both of you had said that you had palate, but they cut them out, right? Is that what they do? They remove them, and then so when you say preventable, is it just that, or if they actually find cancer, is it still better because you've been checked that you can actually deal with the cancer more quickly?
Correct. Both of those things are true.
So how do they do it? Does the cancer look just like the polyps? It actually is one of those, and you have to. How does that work? How do they know it's cancer? I'm asking all these things.
Sure.
It's like they meet you at a party. Hey, Doc, I've got this thing. It's like, I'm not trying to do that.
No.
But I do want to know, right?
Yeah. So the lining of the intestines turns itself over very quickly. So cells that are always replicating in the body are the cells that are at higher risk for cancers.
Oh.
So as those cells are turning over, the DNA, the genetics of the cells has to be preserved very carefully, or else cancers can develop. So the polyp is along that course between normal intestine lining to cancerous intestine lining. So the polyp is that early stage of disease that, if untreated, can progress into a cancer. So by removing the polyps, we're taking these precancerous lesions out of the colon. Typically what we see is the polyp can get bigger. If it gets bigger and starts having more genetic changes, the polyp can have something called dysplasia, where the cells start to look very bizarre under the microscope. The next thing that we see after that bizarre change is those cells start to invade into the tissue that they're surrounding. And it's that invasion that truly makes this a cancer. The cancers then start as very small cancers that sometimes even just taking the polyp out can remove the cancer, and now you're cancer-free, all the way to the point where the cancer is very large in the intestines, sometimes blocking it, and unfortunately those cancer cells can spread through the body, called metastasis or metastatic cancer. That's what people hear about when they hear about stage 4 cancer. Colon cancer at stage 4, we're very good at treating, but we're not very good at curing. So typically people can live 2, 5, sometimes even up to 10 years, even with metastatic colon cancer. But if you have that very earliest stage of cancer, either stage 1 or stage 2 cancer, where the cancer hasn't yet started to spread into either lymph nodes or other parts of the body, those tumors are very well treated with surgery, like what I do, and patients can have a 90% plus survival if we catch the cancers early, versus, as I said, the late stage cancers where things have started to spread. We don't save those people's lives, but often we can keep them going for many years living with cancer.
So here locally, so do you guys do colonoscopies at
We don't do
Peachtree?
Peach,
Or is
not at
there a
Peachtree,
place
no.
to connect?
We can absolutely get you referred out to
That's-
doctors
yeah, that's
that
what I
will
was
do
looking
that,
for.
or we
Yeah.
also do the at-home testing that we can order at Peachtree. And it's really important to get screened because a lot of times there's no symptoms with cancer of the colon. That you can actually develop symptoms, and if you do have any symptoms that are concerning, you should definitely go see your physician. But a lot of times there are no symptoms at all, and that's why it's important to either do the at-home testing or get a colonoscopy, so hopefully we can prevent that cancer from developing.
So when you talk about surgeries to do that, so are you saying that there is a surgery beyond the colonoscopy where they take the polyps out? So if it's spread, do you actually have to like take part of the colon out, or I mean, depending on where it's at? So is that what you're talking about? But that's a whole major surgery then.
Right. So if
Got it.
when the polyp is removed, if we see that there are cancer cells that are either at that removal site, we call it the margin, or evidence that it's gone into these deeper layers of the colon where the blood flow is that can start to have the tumor cells spread. You see a colon surgeon like me or a general surgeon. We do some staging studies that look at the rest of the body. As I mentioned, sometimes the cancers can move around. But if we are pretty confident that the tumor is confined to the colon or the lymph nodes that are right around it, yes, at that point you get a piece of your colon removed. And the good news is you can remove very large amounts of the colon and people can still live very normal lives. So.
You knew where I was going. Because, I think about that. The medical profession, I don't know how you guys keep up with it. I mean, it almost changes daily. It's just amazing what they can do. And someone had told me that. They said, I had a portion of my colon removed. And I thought, can you do that? Well, apparently you can do that, right? And so you guys are very good at, look, let's try to prevent it. But if it's there, then let's treat it. And if the treatment includes removing a portion, you can still live with a portion of your colon removed, right? It's not like, I mean, I hate to say it, but I'm sure there is a reason we have tonsils. I just don't think the medical profession has figured that out yet. So we'll just take them out. I still have mine. I don't know. Maybe they'll take them out later. But there's certain things that it's like once you know, you know.
Yes.
And in this particular, since this is the month for that, we want to encourage people, it's better to know.
Correct.
You know?
And it's not that you're going to ignore something permanently. The problem with cancers is at some point you're going to be faced with a very challenging problem. So the goal is for all of us to recognize we're at risk of cancers, take steps to prevent or at least diagnose problems when they're early and very curable.
I appreciate it. Well, guys, I have to tell you, I'm very grateful that you guys took opportunity, but took the time. I'm sure both of you, your jobs are boring. You hardly ever have anything to do. You sit in your office and read Golf Digest.
Just drinking coffee, right?
Drinking coffee. I have to ask that. The common thing is all doctors are golfers. Do either one of you gentlemen golf?
I do not.
Once every 2 or 3 years with my brothers-in-law, but that's about it.
You guys are breaking the mold. When I became a pastor, they said you either got to fish or play golf. And I said, where's the boat? We live in a great area for that, All right, one more thing. And so, Dr. Matthews, you unless they're in Chico, they're not coming to see you, but you definitely want to encourage people to get a colonoscopy to get checked, right?
Sure.
But Dr. Kalpas, you are here locally.
Yes.
So I want you to talk just a minute about Peachtree, where it's at, how do people get connected with it?
Yeah, absolutely. We have clinics all the way from North Sacramento all the way up to Chico here in Marysville, Yuba City, Live Oak. And so just give us a call. We'll get you scheduled to see one of our wonderful physician or other providers, and we'll take care of all your medical needs. And if you need to go see, a wonderful surgeon, we'll get you sent over there, but we'll take care of...
Send me to him. If I got to go, I want that guy. Yeah. Okay, so I didn't know that. You guys have multiple locations. I thought you really.
We do, and we have family practice, we have pediatrics, we have
Wow.
reproductive health, we have podiatry, orthopedics, dental, behavioral health, psychiatry, lots of different types of services. So we really are a very well integrated health system here.
Well, because I have VA Health, they've been very gracious, my doctor, to let me go locally because otherwise I got to go to Chico. No offense, Doc, but
It's a drive.
the drive, or go to Sacramento to Mather, which is a drive and then good
And
luck
traffic.
parking. yeah, it's like so there's a lot there. My wife likes to go because they have an Arby's in both those locations. So that's the only reason. Other than that, we like to stay local. But I did not know that Peachtree Health had that many different.
We also do eye care, chiropractic, all kinds of services.
I love it. This is great. All right, so Peachtree Health would be peachtreehealth.com.org. I mean,
Pick Peach.
Huh?
Pickpeach.org.
Pick Peach?
Yes.
You're making that
No,
up.
no, that's it. Pickpeach.org.
Come on, folks. You know that's cool. Pickpeach.org. That's just the best ever. And then, anyway, Dr. Matthews, appreciate you coming in, taking the time, being regional, every county that connects to us, right? And so we appreciate that. And thanks for coming on, Doc, because it's one more time we find out in the Yuba Sutter area just how well we're taken care of. There are facilities available right here to meet the need. Any last words? Not like last words.
No, we'd love to see you at Peachtree, and if you need your colonoscopy, I'm sure you can take care of that for them.
And that's exactly right. Make sure you remember your colon in the month of March. I think Dr. Kalpas had sort of given a quick little plug, but if you develop signs that are worrisome in your colon, please don't ignore blood in the stool, change in bowel movements, sudden weight loss that's unexplained, any signs or symptoms of trouble. Don't ignore those. See your doctor.
Perfect. Thanks so much.
Thank you.
This community interview is made possible by Shaw and Associates.
I'm Dave Shaw.